everyone. Welcome to the live show. Thank you for joining. We are live on Facebook and YouTube. With me here, I have Dr. Stephen Ojuang from Premier Care Hospital Group, and he'll be shedding some light onto why it's important to do a wellness checkup and how different specialists can make your healthcare experience memorable, in addition to giving us some insight into Premier Care's outpatient specialist clinics. Karibu sana daktari.
Thank you very much.
Thank you. So as we start off, maybe you could introduce yourself, tuambie who you are, what are some of the things you like doing, what are your hobbies, just to familiarize ourselves with you.
Yeah, thank you very much, Holiday. My name is Dr. Stephen Ojuang. I'm a consultant radiologist with the Premier Care Hospital Group. And we are here because when you look at the healthcare industry around us, or basically the environment around us, if you're looking for quality healthcare, you either have to travel to Nairobi or to the big cities to be able to get that. And when you do get the service, it is either expensive, or you'll have to have spent so much time and money on logistics to be able to access that quality healthcare, especially for those who don't necessarily live within the big cities. Now, we are here to change that as a group. When we started 8 years ago, we sought out to be able to provide that quality imaging, diagnostic, and specialized care to areas outside of the big cities. And when I was working in Nairobi, I noticed that we had a lot of clients coming in, spending a lot of time and resources, and some of them could not even make it to the major hospitals. Yet everyone deserves that world-class care wherever they are. So that is why we're here as Premier Care Hospital Group, to provide that solution that will save you and your family members time and money, while giving you the best quality that you trust wherever you are. Yeah, so that is, in summary, who we are and why we exist as a group. We started off with our first branch here in Kitengela in the year 2014 as a diagnostic center and outpatient. So by God's grace, we've been able to grow from seeing 78 clients in our first month to now over 25,000 in a year. So we really thank God about that. And we are here so that we're able to provide that solution for you wherever you are. We're also in Narok, where we have 2 facilities. We have a diagnostic center and an inpatient facility as well. And we've been to places like Garissa and Loitoktok as well, also just in there, with the aim of providing that wholesome care that everyone deserves, irrespective of where they are. So, in summary, that's who we are, and that's what we do.
Thank you so much. So just to get it clear, you've mentioned that Premier Care Hospital Group has 2 branches. That's one in Kitengela and the other one in Narok.
Well, we're in 2 locations currently, and soon we'll be in a 3rd location. That is on Mombasa Road. So currently we have one specialist and diagnostic center in Kitengela, and a similar one in Narok. But in addition to the diagnostic center in Narok, we also have inpatient services, because we realized that we were not solving the problem completely. Yes, we were able to diagnose the patients and see them as outpatients, but there was still a lot of people coming to Nairobi from Narok to access services. So that is what prompted us to be able to establish the inpatient services, which has maternity care, it has specialist care, including dialysis and theater services. Yeah, just to be able to again save the cost and the time for the people in Narok and its environs.
Thank you so much for that. So in addition to, you've mentioned maternity and dialysis, which other services, maybe if you could just mention for us, which other services Premier Care offers?
Yeah, so we are very keen on providing preventive care, especially in this day and era where there's a lot of cardiovascular disease and there's a lot of cancer cases. So we are very keen in offering screening. That's screening for wellness, and that involves checking things like the blood sugar, checking your weight, your BMI. How is that? Is it okay? Screening for cancers as well. We screen prostate cancer, for breast cancer, for cervical cancer, for lung cancer as well. So that is part of our wellness checkup that we encourage people to do at least once every year, so that you don't have to wait till when someone is going to the grave, or when the disease has moved on and advanced, you're at stage 4, to be able to get quality service. So medical checkups is one of the things that we do. We're also able to diagnose those who already have the disease, including any form of disease, through the various services that we provide, including whether they need a CT scan, whether they need a heart checkup, through ECG and echo services. In case they need a screening of the colon or the bowel, we work with a team of surgeons and endoscopists who are able to help us do that. We also are able to do other screenings like for cervical cancer through pap smears as well. So we take that very seriously. It's our mandate to make sure that our population is healthy. But even those who've been diagnosed with disease, we work very well with physicians from the various hospitals, and even from even beyond the borders, to be able to just provide that accurate and timely diagnosis and now treatment to our clients.
Thank you so much for that, Dr. So as we go to the main agenda of this live show, maybe you could give us more light into what exactly does it mean when you say outpatient specialist clinics? What exactly does that refer to?
Yeah, thank you, Halid. So what an outpatient specialist clinic refers to is that we know that there are so many clinics out there, and some of them we work very closely with, who offer the routine and regular checkup. So the gap that has been there is that apart from just the normal, you probably find someone who needs, in addition to the normal care, they'll probably need to be seen by a specialist who is either a dermatologist, for example, or a cardiologist, or even a urologist who looks at men and issues with the prostate and the urinary system, and reproductive system in men. Or maybe even someone needs to see an orthopedic surgeon or a general surgeon, or a physiotherapist, because they are chronic back pain and they need to be monitored for long. So we thought, instead of someone coming and getting one service and they miss another, ours is a one-stop shop, whereby we thought, let's put all these services together, so that if someone is looking for any specialist, then they're able to get them in the same place. You can have your check for your baby, you can have your pregnancy checkup done, you can have your natural clinics and follow-up done, you can see the gynecologist if you want to see them, all within the same facility. So without having to move around.
Sorry, Dr. Ari, we've lost you a bit.
Everyone has
Sorry, Dr. Ari, we lost you a bit on the last part.
Sorry about that. Yeah. So so I was saying that not everyone has all the time to be able to move around from there to various facilities to be able to get medical care. If someone, let's say, needs to have their baby checked up, or even prepare for delivery, and even care after delivery, or is it immunization? So that's why we are here, so that we provide
Tumekupoteza kiasi. Sorry about that. Daktari, are you getting me?
Yes, I can hear you.
Sorry, I think I don't, technology. We
Sorry
lost you a
about
bit.
that.
Every time you're about to explain to us, we lose you a bit, especially at the end.
Yeah. So sorry about that.
Yeah.
Um, so as I was explaining, we are here to provide a one-stop solution whereby a client can be able to get full service without
Mm,
necessarily having to waste a lot of time and money moving between one facility and
yeah.
another. Yes. So we offer
Okay.
comprehensive care for all the specialist clinics, whether the woman is
Mm-hmm.
pregnant, whether it's your parent,
Mm-hmm.
you want to be checked to have their checkup done, whether someone needs cancer staging, whether someone just wants to do a pap smear screening, whether someone needs to see a dermatologist. So ours is to provide that solution in a one-stop shop model.
Mm, that's nice. So what I'm getting is one of the things you're looking to meet is just provide convenience to your patients as well, so that they don't
Exactly.
have to keep going to different places when they can access the services in one place. That's right.
Exactly.
Thank you so much for that. So are these outpatient specialist clinics, are they available in all your branches?
Yeah, so we have the outpatient clinics
Mm-hmm.
available in Kitengela, in
Mm-hmm.
Narok, and soon Mombasa Road as well. Yeah, so they are available in all our branches, whereby we seek to make sure that people get the quality that they deserve. They're able to see if you want to see a general practitioner, which ideally is where most people start, they're able
Mm-hmm.
to do that. But also in case you need to be followed up, maybe you want to save the distance to travel to your specialist. Yeah, so we are there to make sure that you don't have to travel all the way from Narok, for example, to see a physician or a cardiologist because they are there in
Yeah.
Narok. Sometimes we
Mm-hmm.
arrange for them to visit on a scheduled basis because,
Mm-hmm.
like the ENT specialists, for example, they come on certain scheduled days. So for those who may not be there daily, like the physicians, then we have regular days within which they are able to come and provide service for our
Yes.
clients.
Thank you so much for that. And just to know, when exactly are these clinics usually open? Are they open all through the week? Do they have specific days and times? Maybe you can take us through that as well.
Yeah, thank you. So we are open 24 hours in all our units, and
Mm-hmm.
for the physician in Narok, they are available. The physician is available every day.
Mm-hmm.
For Kitengela, it's on scheduled days, but we don't. We what we are there to make sure is that a patient doesn't wait for long. So
Yes.
you just need to give us a call, and within no time, we'll make sure that you're able to access service. We have specific days within which the gynecologist attends in Kitengela. The regular
Mm-hmm.
clinic on Wednesdays. In the afternoon in Narok, it's any day. We work very well
Mm-hmm.
closely with the gynecologists who are in Narok.
Mm-hmm.
For the urologists, again, they're available on need basis. Yeah, but in addition to
Mm-hmm.
that, we also have full-time radiologists and
Mm-hmm.
pathologists on selected days. So the rest of the clinics have a guideline. So all the client needs to do is to get in touch with us, and we'll be able
Mm-hmm.
to specifically assign you on a day that is convenient for you, so that you
Mm-hmm.
don't have to wait. Because remember, you want to save time and money. But
Yes.
additionally, we have very highly trained general practitioners as well, who are then
Mm-hmm.
able to handle any emergencies, whether it's
Mm-hmm.
during the day or at night. They're able to give that fast contact of point of contact for our patients, even as they plan to see their specialists.
Mm-hmm. Wow,
Yes.
that's very, very insightful. Thank you so much for that. And maybe just to also know, if someone wanted to access these services, will they have to book an appointment? Can they just walk in and, have the services delivered? How is the procedure like?
Yeah, so for the diagnostic services, including colonoscopy, endoscopy, lab, and radiology,
Mm-hmm.
and general physician consultation, they can walk in
Mm-hmm.
anytime, day or night, and we'll be able to assist them. For the
Okay.
specialist clinics, feel free to call any of our numbers. Largely, the physician is available on a daily basis in Narok, in our Narok clinic. For Kitengela, they are available on scheduled visits. So we would encourage as many of you as possible, reach out to us, whether it's on Facebook. We have, we'll soon be having a WhatsApp platform as well, where you can quickly narrow down to what exactly you want and be able to book live, to book a clinic, and within the shortest time possible, be able to access service. So yes, to answer the question, we have those services which are available on a regular basis, 24/7, including the pharmacy as well. So we have the pharmacy general consultation. If you need a scan done at night at 2 a.m., if you need an urgent lab test, yes, those are available on 24-hour basis. And then for the other services, the specialist clinics, selected clinics, we have scheduled days when those are done throughout the week.
Okay. Thank you so much for that. So someone had inquired on Facebook asking if you guys accept NHIF, and just to sort of broaden that question, maybe tell us, do you accept insurance for these services? And if you do, maybe you can highlight some of the ones that you accept at Premier Care.
Yeah, thank you. In this day and age, we are all trying to save time and money, like we mentioned before. Yeah, so we'd encourage as many people as possible. Please get your insurance, whether it's NHIF for you, for your staff, for your family, and of course we also have the other private insurances. So the insurance cover in the country is only 19%. Yeah. So we'd encourage as many of us as possible, because it costs money to be able to pay cash, especially for something that you're not prepared for. So if you're able to get insurance, please go ahead and do it. So in addition to the NHIF, we have many other insurances. Actually, maybe the question is which one we do not have. So we have insurances like Jubilee, AR, CIC, First Assurance, there is Sanlam, there is Saham, there is UAP, there is Kenya Alliance, we have Liaison, we have KCB, we have Equity. Yeah, so we have most of the major insurances on board. Yeah, so again, feel free to get in touch with us, and we'll be able to answer you whether we have your insurance. Chances are we will, because we have most of the insurances. General GA assurance insurance as well, yeah, is another one. So we have most of the insurances. And for those we do not have, we are working aggressively to make sure that that we bring them on board.
Yeah. Thank you so much for that. So do you have any final thoughts, any last words based on that, or maybe anything you'd like people to know about Premier Care or about the services you offer?
Yeah, thank you. I think my parting shot would be to make sure that don't wait to be sick to go to hospital. Yeah, spare that one time in a year, and it could save a life. I remember we had one of our professors when I was training for radiology. He just was doing his routine checkup and was found to have a small issue in the kidney. And when it was checked, it was discovered that it was actually an early stage cancer. And guess what? More than 10 years down the line, he's living cancer-free because he went for his routine checkup, and now he's okay and he's moving on with his life. It was treated. Yeah, so don't wait till you're sick to get to the hospital. Come for checkup, come for that screening, and perchance, if God forbid someone is unwell, then we are available to be able to assist them to do that diagnostic care, and to be able to make sure that they get the world-class service that they would get anywhere in the world without having to travel far to get this service. So feel free to reach out to us if you feel there's a need in your area that maybe is not addressed.
We've lost you. We've lost you, kidogo.
And we'll hope. So
Sorry,
we'll be happy to reach out to you. Feel free to, in case you need these services where you are, then we'll be able to plug in. Feel free to reach out to us. We see how we could assist you get the service. And you never know, we soon will be coming to an area near you. So watch this space, and we are looking forward to serving you whenever you need us, and we wish you well, even in your journey of good health. We wish you good health for you and your relatives, and feel free to reach out to us for any need that you may have that is health related. Thank you.
Thank you so much for that, Dr. You've given us such wonderful insights today. And, most of us actually believe this information when it's coming from a specialist. Because sometimes when you hear these things outside, you might ignore, but when you're being addressed by someone who's actually specializing in that, then it seems more credible. So thank you so much for that. If you're watching the live show, share the link with your network and your friends, and also be sure to connect with Premier Care Hospital Group on their social media. So that's Canlab Kitengela on Facebook and Instagram, and there's another Facebook page that goes by the name Premier Care Hospital Group. Thank you so much for watching. Thank you, Daktari, for sparing your time to be with us. Asanteni sana.
Thank you. It was a pleasure. Thank you. Bye.